with the Supreme Court ruling that the Affordable Care Act, also known as Obamacare, is constitutional. It means big changes are coming. And like all Americans, Connecticut residents will soon start seeing how the law is going to directly affect them, if they haven't already.
The Affordable Care Act actually has already brought a significant number of changes for the residents of Connecticut. It will bring additional protections in 2014.
Victoria Veltri is the director of the Office of Healthcare Advocate, which is a state agency set up to help Connecticut residents with any issues that relate to healthcare. Veltri says something that is important for residents to remember is that if they have health insurance and like it, they won't be forced to lose or change it. The law is meant for those without insurance, which in the big picture helps everyone.
Unfortunately, because they are without coverage, they will utilize care that's higher cost and oftentimes uncompensated, and what happens is that cost gets shifted to all the people who are currently paying premium.
Reforms in this law will also apply to everyone.
The dependent coverage till 26, that's the Affordable Care Act. No annual limits, the Affordable Care Act. No lifetime limits, the Affordable Care Act. Preventive screenings with no cost sharing, Affordable Care Act. No donut hole, Affordable Care Act.
With healthcare being a large part of the U.S. economy, this law will create a fiscal impact. Even though the Congressional Budget Office predicts that the Affordable Care Act will reduce the size of the federal budget deficit over time, not everyone agrees on that. Like Zachary Janowski, who's an investigative reporter with the Yankee Institute for Public Policy. Though he's for making more Americans healthy, he says that the math in this legislation doesn't add up.
That's why many of the benefits from the Affordable Care Act haven't started yet, because we're still saving up money to pay for them down the road. And that's why it looked like it helped, it didn't affect the budget deficit.
He says what will hurt Connecticut taxpayers is that we will not get in return what we pay for.
Because Connecticut pays taxes disproportionate to other states, we're a donor state, what some people would call us. We pay more to Washington than we get back. We're going to end up paying for some of these added costs to other states.
For those calling for repeal, though, it's important to note that the CBO has come out with new estimates since the Supreme Court ruling, and if the Affordable Care Act is repealed by Congress, they say it would increase the federal budget deficit by $109 billion between 2013 and 2022. For LocalOnlineNews.tv, I'm Adam Chiara.